Hi, this video is the 1 year follow-up. Aras gonna explain and share the audience what his journey of hair loss and hair transplant look like. And so before we do that, I'm going to quickly show what Aras looked like a year ago, and that's what he was. And again, with a high hairline, and when you lose your hair, you actually look a little bit older. And then a year later, when you see his young, handsome face came back out, and you see Ryan's temple, lower the hairline. Ryan's temple, lower the hairline. The most important from here to here. Okay, so Ross, the stage is yours, and go ahead, start from the beginning.
So, I guess I came to Dr. Diep with a serious, what I thought was a serious problem. And I know everybody's affected in different ways, and I have my way that was affected, but I think there's a lot of common things that people, male or female for that matter, keep in mind. It's your daily function, right? You wake up, you know, you've gone through the daily functions of making your hair, and now all of a sudden you really don't need to worry about making your hair because you have hair loss. And it really takes away from confidence. I think that's one of the biggest things, and that's a common ground between anyone. When they have something and then don't have it, you lose confidence, and it spans across many different aptitudes. So with that said, I went, you know, on the internet. That's pretty much where everybody starts. Go on the internet, type in hair transplant. And did I think that I would actually do it initially? It was not like, oh, I have to get a hair transplant, but let me see what it's about. A little bit of research, you know, find out who's around in the area, who's a reputable name, and I obviously came across you. And searching through, I actually watched the videos on YouTube before I came to see you for the first time, so I had some idea of what the previous people had experienced, which is why I'm sitting here today, because I wanted to share my side of this story.
Yeah.
And
so you're actually now the guy on the video.
Now I'm the guy on the video that used to watch the videos. So I found Dr. Diep online, and I had actually seen 6 other doctors before I saw you.
So you do a pretty thorough job.
Yeah, so it was not, when something, in my eyes, this is not a price-driven thing, or it's a result-driven thing.
And that's really important, to tell you the truth, because you chase price, you end up cost you more in the long run. You know?
And that's what I had read on I had done so much research, forums, videos, whatever it may be, and people were going into, they'd gotten a transplant and they were going to their 2nd or 3rd transplant to fix a problem, and they at that point didn't even care if they had hair anymore. Their main goal was just to fix how bad it looked. So I knew that wasn't something I wanted to go down. I would rather have paid the premium for it, spent the time, you know, if a...
That's why you didn't go to Turkey or
yeah,
India.
Actually, that's correct, actually. Turkey is the country that does the most hair transplant per day these days. And my comfort zone in another country, the other thing is I wanted to have access to someone that's near me. If there is a problem, I could go to him or her. So keeping all these factors in mind, proximity, cost being reasonable, the time, and I think the biggest thing was the comfort, the level of comfort. When I walked in through that door and when we sat down in your office for the first time, there was a level of comfort. And going under the knife, I think for any procedure, whether it's hair transplant or anything else, I think it requires a certain degree of comfort. And I hadn't had any other surgery before, so this being the first one, I had to make sure that I had that comfort. And that is exactly why I ended up here with you, and now a year later in this chair. The day of or actually even leading up to the day of, there's obviously anticipation.
Were you nervous?
Absolutely.
Anxiety.
Absolutely.
It's common, you know that, right?
And on top of that, you said be here at 6 a.m. And it's like, all right, we're going to start this day at 6 a.m. We're going to be there for 10 hours or whatever. I think by the time I left here, it was around 6 p.m. So just knowing those facts, I was pretty nervous going into it. But came in, day of surgery. You were here before me. You know, I did not want to walk into a situation where, oh, where's Dr. Diep? Oh, he's running 15 minutes late, 20 minutes late. So things like that, personally, to me, make a big difference. If I'm asked to be on at a certain time, I expect the same from someone else. And then, yeah, the day of the surgery was a long day. There's no doubt about that. Was it comforting? Yeah, we had food, we had, you know, everything was taken care of.
Does Xanax and Valium help?
Absolutely.
You know, it makes the perception of surgery less, right?
Yeah.
Even though it's a long day.
Yeah.
But
Yeah. No, it was. But at the end of the day, the way I looked at it was a long day that was going to be a productive day. And again, it was a result-driven day, right? At the end of this whole thing, if I saw the result that I anticipated seeing, then that 10 hours was absolutely worth it for me. So the day of the surgery, I think I don't think it could have gone more smooth. It was a very simple process. You know, come in,
right,
take your seat, and go under the knife. There wasn't much more to it. So it was a good day. I went back home. I remember I was on the phone with a friend, and I don't even remember that conversation next day. So there was definitely some painkillers that were required, but overall it was a very good experience. The healing aspect of it is a little different. I think the first week out of surgery is painful. It's not very painful, and it's more discomfort rather than pain. It's you're going through this. Your body is going through this new experience of adding hair as opposed to it constantly losing hair. Right. So yeah, it's traumatizing to it. But again, nothing too extraordinary, and nothing that I wasn't warned of before. So that's the other thing. If I wasn't warned about something, I would be a little bit more nervous about the reactions that took place. I actually want to quickly touch on one thing. There was the next morning. I remember waking up with my eye a little swollen. Okay. And the first thing I did was give you a call, and I got a response right away that is normal. So
you have my cell phone.
Yeah, exactly. Yeah. So those are the things that I think will make me recommend this place to anyone else. Actually, that we could get in touch when I needed that reassurance. It was there. And I think for me that was one of the biggest things, and after that there was no other problems.
To tell you the truth, you know, I'm not a big corporation, so big corporation after surgery you won't be able to talk to the doctor. But being run my own place and all stuff, I provide my own personal cell phone to all my clients. Even on Sunday, you know, I pick up the phone after hour. Because I'm on call for my client and I want to be there for them. But sometimes when, you know, I'm in the operating room or seeing patient, then in between you text me, I answer all that. But my secretary is pretty good at answering some of the questions. But definitely I will be there for my client. So I'm sorry to interrupt you.
No. But it just, I think when you hear it from the horse's mouth, like you're okay, it's normal, it just makes you feel like, okay, I can go back to bed now. Right, so because I remember waking up at 6 in the morning and my one eye not really opening. Yeah. I'm like, is this a problem right now, or is this not? But other than that, the healing process was that 1 week. After that 1 week, it's not a problem at all. You come in for a few hair washes. At least that's what I did. I didn't do anything myself because I said, you know, I'll leave it to the people that have been doing this. Came in for my hair washes, and then after that, it was. All right, you're on your own, and there's nothing really too complicated about it anyways. So from there, it was just playing the waiting game. And
that gotta be stressful. I don't know. It's not everybody's the same though.
Actually, so my growth procedure was not too bad actually compared to what the things that I've read online. People complain that after the procedure they have hair growth, like their hairline looks good. That's immediately after the procedure, but you know, 2 months down the road they have excessive hair loss because of the shock that they had goes through. I did not experience that. Now every individual has their own body and it reacts in a different way, but I didn't have any of that kind. So it was just a matter of, okay, now I have to wait, and after about 6 months, at 6 months I was already happy with my hair.
Oh, that's awesome.
Yeah. So at 6 months, I thought if it doesn't grow anymore, I'm completely okay with this result. But 7 months got a little better, 8 months got a little better, and now we are a year later. So and again, if since this is pretty much the final product, I can't say that this hasn't been a very, very successful undertaking from my side.
So did anybody notice you have had surgery?
Nobody had noticed. I did tell people. I did not. It's not something that I felt I was that embarrassed about, but it's actually never been noticed. No one has ever like come up to me. Actually, I saw some friends after about a year, and they're like, "Whoa, what happened to your hair? It's flowing." And I'm like, "Well, yeah,
that's good.
You know, like, maybe it's less stress or something." But I didn't bother saying anything else about an actual procedure. But yeah, there were people that I told, and they said it's a huge difference. So.
Yeah, and Ras, I thank you again, because it's very difficult for me to get an Indian client to show a full face. But you know, it's important because they will give and share each individual journey is different. You know, the recovery or otherwise, and I think the audience will appreciate what you went through and those stuff, and all the nervous time, you know, prior to surgery, and it's normal. And then during waiting time is stressful. But again, it takes a year for it to fully grow. But for Aras here, it's 6 months, and he has his hair, and not just the density improved, but you see more volume, right?
Yep.
And they're going, and okay. So the audience, thank you again. Just for the audience to understand what your journey is like, and again, I'm gonna show what he was. And that's where he is now. Thank you.